Have you been told that you have a lumbar disc herniation? If the answer is yes, did anyone tell you what that actually means and what you need to do to fix it? And yes, it's definitely fixable without any kind of injections or surgery. So you could think of a disc as a spongy cushion that goes in between the bones of your spine. And its purpose is to provide support and stability that allows for proper movement within your back. Now, if a disc becomes herniated, it will occupy a space that it shouldn't be in. And when this happens, it could press and irritate a nerve. So when that happens, you can experience significant amounts of pain, weakness, numbness, burning, and tingling. Now, this can happen from the result of a trauma, or it could happen over the course of time. It really depends on the person and their situation. And I want to show you guys 3 of the best moves for this kind of situation that have helped and done wonders for all of my patients who have disc herniations. So the first movement that I want to share with you guys is a really simple move, and it is so great for anyone experiencing low back pain, especially disc herniations. So like I told you before, sometimes the disc kind of goes out of place and starts rubbing and irritating things because it's in a place where it shouldn't be. So this exercise can help mobilize it back into place. So this is also great for people after any kind of injury because you become very avoidant with certain movements. And this, as well as the other exercises, are going to start to restore those movement patterns. You'll also feel like you're massaging some of the muscles that go in that area. You're going to improve blood flow, and you're going to improve that connection from your brain down to that area of your body where it essentially has been kind of shut off for a period due to pain. So to start this exercise, you're going to take your hands, put them behind your head, and you're going to lean all the way side to side. So you're going to go into like a mini squat position, just like so. And now from here, you're going to bring your right elbow down towards your right hip. So maintain like a mini squat and go side to side. And whenever you think you're done in terms of range of motion, you could always go a little bit further and go back the other way. You might feel a stretch, some pops, anything like that. That's totally normal with this kind of movement. And you're going to go back and forth. So I just showed you one on each side. And back. So for me, I just got like a pop in my back, totally normal movement. I also feel a very big stretch on the opposite side when I go down, especially towards this direction when I go to the left. Again, very normal, expected. If anything causes like any type of sharp pain when you do it, like, ow, this is hurting me, don't go as far to the side. I'm pretty flexible in those directions, so I'm okay to go travel further. But again, if your pain starts here, then just go to here or back off just to drop off of it, and that's fine. So for this exercise, I want you to do 10 repetitions to each side. So back and forth and back to start is 1. You're going to do 3 sets, 10 reps. So the next exercise that I want to share with you guys is called a windmill. And this is one of my favorite exercises for anyone having any kinds of low back pain, especially a disc herniation. Now, what I like so much about this exercise is that it's a 3-dimensional movement, which is super important for our spines because our spines need to move. Now, oftentimes when we experience any kinds of pain, especially low back issues, we end up stiffening up and not moving. This exercise forces you to move in not just one simple plane of motion, but 3, because you're going to be rotating, side bending, and it's super simple. You don't need any kinds of equipment, and you could essentially do it anywhere. So to start for this motion, you're going to go into like a little bit of a mini squat position, just like so. You're going to take your hands or your arms, extend them, and I'm going to start by showing you what the movement will look like on my right side. So if I'm going to my right side, my left arm is going to be pushing hard into the inside of my left knee. My arm is going to have a gentle push into that left knee, and my knee is going to have a gentle push back into my left arm. So, and I'm going to be in this position, hands together, and I'm going to rotate my arm up towards the ceiling, hold it for 2 seconds, come back down. Now it's important that your head will follow your hand as you rotate up and across. Hold it, 1, 2, 3, come back down, and go up again. 1, 2, 3, and down. So I just showed you 3 reps. I'll show you what it looks like on the opposite side. So everything stays the same. Right arm into right knee. They oppose each other when you push. And now my left hand is going to come up and over. 1, 2, 3, and back down. 1, 2, 3, and back down. And it's important to note that when you do this kind of motion, you might experience some stretching. You might even get a couple pops in your lower back. That's all entirely normal. As long as there's no associated pain that goes along with these movements, that's totally fine. If you do experience any kinds of sharp pain or anything like that, what you could do is not go as far up when you rotate. So for example, if you're okay here in this range of motion, but anything past this is painful, just stay in the range that you can comfortably. Again, so if this feels fine to me and I go here and that's painful, that's okay. I'll go a little bit lower. And what you can do is even hold it here for like 30 seconds, 20 seconds, whatever you're comfortable with doing, just to get your body used to this positioning. Go back to the start and try to go even an inch further than what you just did. So if I just held it for 30 seconds here, come back a little bit higher and go back down. I love movements like this because it's like, in a way, tricking your brain to say, hey, we're moving, it's okay. There's not pain associated with this, and we should be okay to keep going further and do more. All right, the most important thing that you need to do with any kind of injury is to move. And unfortunately, despite how smart the brain is, it sometimes does something kind of stupid where it's like, okay, every motion hurts, let's not do it at all. So again, for the windmill, you're gonna do 2 to 3 sets on both sides, and you're gonna do 10 reps to the right side, take a break, 10 reps to the left side, and you could cycle between that for 2 to 3 sets. So this next exercise is a great move for anyone experiencing any kinds of nerve tension that goes down the leg. If you remember when we spoke about disc herniations and how it moves out of place sometimes and can rub and irritate a nerve, this is a great exercise to address that. If you have any kinds of numbness, burning, tingling, or pain that goes from the butt down the leg, this move is for you. So nerves are just like muscles in that they are both soft tissue structures and that they both need to be able to stretch, shorten, lengthen, that kind of thing. So this exercise will help address that really, really well. So it's really simple to perform and you need to be sitting for it. Ideally, you want your leg pretty much supported by a chair, bed, couch, whatever you have. So what I like to do is slump my head down to start, slump my entire body down, and you could hold on to the surface you're sitting on just like so, hands in front of you. Ideally, I like to have my hands in front of me just so I could kind of slump more and be in a better position. Now from here, you are going to bring your toes up. So I'm going to show you on the right side, and you're going to, as I say, like to kick the ceiling. Your leg might be a little shaky like mine is here. And as you kick your foot up, you're going to extend your head. So I like to call it kick the ceiling, kick your head, and you're going to hang out here for 3 seconds and come back down. Kick the ceiling, your head comes up and back down. Kick the ceiling, 1, 2, 3, and come back down. So when you do this exercise, it's so normal to feel a pull that might go right into the part of your low back where you have pain. That might be where the disc herniation is originating from. You might feel a very strong stretching, pulling sensation behind your entire leg, behind your thigh, behind your knee, all the way down behind your calf, down to the foot. You might have those nerve symptoms that you experience, numbness, burning, tingling, any one of those things. It might get a little bit worse as you do it because you are stretching the nerve and you are irritating it a little bit, which is normal because, again, in order to make some changes with this kind of issue, you do have to irritate those structures. Totally fine, totally normal. What it shouldn't be is like a ridiculously sharp pain where it's like, I can't handle this anymore. I don't want it to be so severe and so strenuous that it's creating pain or anything like that to a very severe extent. So again, I want you to do 3 sets for about 10 to 12 reps, and I'll show you what it'll look like on my left side, just to show you another side of it. Again, slumped, head down, toes up, kick the ceiling, kick your head, and then nod the chin back down. Kick the ceiling, 1, 2, 3, right back down. And that was 2 reps. You would continue it on the side that's painful or irritated for 10 to 12 reps. Take a minute or 2, do another set, take a minute or 2, do another set. So this last exercise that I'm going to share with you guys is one of my favorite moves for addressing lumbar disc herniations as well as nerve tension that goes down the leg. It's very similar to the last exercise that I showed you when we were sitting, except this time you're going to be on your back. So you're gonna lay on your back. I'm gonna show you what the exercise is gonna look like on my left leg. So you're gonna have both knees bent, and now from here, you're gonna take your left leg, put your hands behind your knee, and hold it here. This is the start position. Now, step one, you're gonna bring your ankle up towards you. That's very important that you maintain that throughout the entirety of this exercise. And now from here, all you're gonna do is squeeze the front of your thigh, keeping your toes up, and straighten out your knee. So it'll get shaky, like you might see on me right here. I can't even get to fully locking out my knee yet. And I'm gonna hold it for about 5 seconds and relax, come on down. Bring my ankle up, reset again, straighten out my knee, and I'm gonna try to go a little bit further if I can. Hold it for another 5 seconds and slowly come back down. Now, as you're doing this, it's totally normal to feel a very strong pull behind your thigh, your knee, your calf, maybe even into your foot. And you might even have some of that pain that goes down into your back where your lumbar disc herniation is. It's all totally normal, and I'm gonna come back down. I'll show you what one more rep looks like. Reset, toes up, straighten out the knee, squeeze the front of the thigh, try to go a little bit further. 5, 4, 3, 2, and 1, and come on down. So I showed you about 4 reps. On this exercise, I want you to do 2 to 3 sets, 10 repetitions with the 5-second hold at the top on every single rep. Again, totally normal to feel a very strong pulling sensation down the leg. Again, you're forcing a nerve that doesn't really want to move. Also normal to have any kind of like localized low back pain, as long as it's tolerable and not a severely sharp pain. If you do get that, again, you can ease off. So if I get that pain from in this range of motion, sharp pain in my low back or anywhere for that matter, you could ease off of it a little bit and just hang out here and desensitize that motion, as well as get used to this part of the range of motion. If I don't feel anything here and I'm okay, you could straighten it out a little bit more until you start to get that onset of symptoms, and just hold it here and reset and go right back up into that range of motion and work into it. So again, try this one out, 3 sets, 10 reps, 5-second hold at the top. So let me know in the comments below how these moves felt for you, and let me know what kinds of things that you want to see next.